MRI stands for Magnetic Resonance Imaging. It images the water molecules in the body, and it does that a very strong magnetic field, which is a big cylinder tube. The powerful diagnostic tools used to examine soft tissues of the human body. We'll discuss exactly how the process is done inside the cylinder tube. It uses superconducting magnets and radio waves to generate images of the bodies. Now let's meet the machine. The key components are the magnet, radio waves, gradient, and a computer. Our body is made of a 60% water, and water is magnetic. Each of the billions water molecules inside us contains of 1 oxygen atom and 2 hydrogen atoms. All we know is it has H2O. Small parts of the hydrogen atoms act as a tiny magnet and are sensitive to magnetic fields. MRI stands for Magnetic Resonance Imaging, and the MRI scanner is one of the main diagnostic tools the doctors use to examine inside our bodies. The first step in taking the MRI scan is to use a big magnet to produce a unified magnetic field around the patient. The gradient adjusts the magnetic field into small sections of different magnetic strengths to isolate specific body parts, for example, the brain. Normally, the water molecules inside us arrange randomly, but when we line inside the magnetic field, most of our water molecules move with the same rhythm or frequency as the magnetic field. The ones that don't move with the same magnetic field are called low-energy water molecules. To create an image of a body part, for example the brain, the machine focuses on the low-energy water molecules. Radio waves move with the same rhythm or frequency as the magnetic field in an MRI machine. By sending radio waves that match or resonate with the magnetic field, the low-energy water molecules absorb the energy they need to move alongside the magnetic field. When the machine stops emitting radio waves, the water molecules that had just moved along the magnetic field release the energy they had absorbed and go back to their position. This movement is detected by the MRI machine, and the signal is sent to a powerful computer. The scanner processes the signal by using advanced algorithms to produce the image. Tissue with less water in it will have fewer hydrogen protons to emit signals back to the RF coils. Those areas appear a doctor on MRI scans. The varying signal strength gets translated into various shades of gray, which radiologists recognize as different as tissue on the scan. MRIs can be used to scan the brain, joints, and other parts of the body in order to highlight abnormality, such as herniated vertebral discs, cancer, stroke, broken ligament, and aneurysms. At the end, if you like the video, please both like and subscribe to learn more about medical equipment.